Many people over the age of 60 begin to notice small but uncomfortable changes when they go to the bathroom. Perhaps you've experienced a little itching or irritation in the rectal area. Maybe you've noticed a small spot of blood on the toilet paper after a bowel movement. Some people also describe a feeling of pressure, fullness, or mild discomfort when sitting for longer periods of time. At first, these changes can seem minor. They may come and go, and many older adults simply assume they are not something serious. The most common thought is often very simple. Maybe this is just part of getting older. And it's true that our bodies naturally go through many changes as we age. Digestion can slow down, bowel movements may become less regular, and the tissues in different parts of the body may lose some of their strength and flexibility. However, doctors frequently see that these kinds of symptoms are often connected to a very common condition that many people feel uncomfortable talking about: hemorrhoids. Hemorrhoids are swollen veins located in the lower part of the rectum or around the anus. These veins normally help control bowel movements, but when extra pressure builds up in that area, the veins can become enlarged and irritated. Over time, this swelling can lead to the symptoms many people notice, such as itching, mild bleeding, or discomfort when sitting. Interestingly, medical research shows that hemorrhoids tend to become more common with age. This happens partly because the supporting tissues in the rectal area gradually weaken over time. In addition, factors such as constipation, straining during bowel movements, and long periods of sitting can increase pressure on these veins. In my years caring for older adults, I've noticed that many patients wait months, sometimes even years, before mentioning these symptoms to their doctor. Often it's simply because people feel embarrassed discussing this part of the body. But understanding what's happening inside your body can make a meaningful difference. The encouraging news is that, in many cases, hemorrhoids can be managed quite effectively once we understand what is causing them and how to reduce the pressure on those veins. So today, let's take a closer look at what hemorrhoids really are, why they tend to appear more often after the age of 60, and what practical steps may help manage them more comfortably. Hello, I'm Dr. Robert Miller. I've spent more than 20 years caring for adults over the age of 60, helping patients understand the many changes that naturally occur as the body ages. Over the years, I've seen how certain health concerns, especially ones that feel a little uncomfortable to talk about, often go unmentioned. Hemorrhoids are a perfect example. Many people assume they're rare or unusual, but doctors actually see this condition very frequently, especially in older adults. And the truth is, once we understand why hemorrhoids happen, managing them becomes much easier. So let's start with a very simple explanation. Hemorrhoids are swollen veins in the lower part of the rectum or around the anus. You can think of them somewhat like varicose veins, but located in the area where bowel movements occur. Everyone actually has these veins. They're a normal part of the body. But sometimes those veins can become enlarged or irritated, which leads to the symptoms people notice. According to medical research, this condition becomes increasingly common with age. That's because several natural changes happen in the body after 60 that can place more pressure on these veins. Things like slower digestion, increased constipation, reduced physical activity, and weaker supporting tissues. All of these factors can make hemorrhoids more likely to develop. Many people believe hemorrhoids simply appear suddenly, as if they develop overnight without any warning. But in reality, the body often sends small signals long before the condition becomes more noticeable. These early signs can be subtle, and because they may seem minor at first, many people simply ignore them. For example, someone might notice occasional itching, mild irritation, or a feeling of pressure in the rectal area. Others may experience slight discomfort during bowel movements or see a small spot of blood on the toilet paper once in a while. Because these symptoms may come and go, it is easy to assume they are temporary or unimportant. However, in many cases, these small changes are the body's way of letting us know that extra pressure is building in the veins around the rectum. I often explain it to my patients using a simple comparison. Think of hemorrhoids like a warning light on your car's dashboard. When that light appears, it doesn't mean the car has suddenly stopped working. Instead, it is a signal that something underneath needs attention before it becomes a larger problem. If the warning light is ignored for too long, the issue can gradually worsen. The body works in a very similar way. Hemorrhoids themselves are not the root problem. Rather, they are often a sign that the veins in the lower digestive system are under repeated strain. Doctors frequently see hemorrhoids develop when there is ongoing pressure in this area. That pressure can come from several everyday habits. For example, straining during bowel movements can push extra force onto the veins in the rectum. Sitting for long periods, especially on hard surfaces, can also increase pressure in that region. Chronic constipation can make the situation worse by forcing the body to strain more often. Over time, this repeated pressure can cause the veins to swell and become irritated. So instead of thinking of hemorrhoids as something that simply appears out of nowhere, it may be more helpful to view them as a signal from the body, a reminder that certain daily habits may need small adjustments to support healthier digestion. Let's take a moment to understand what is actually happening inside the body when hemorrhoids develop. Under normal conditions, the veins around the rectum play an important role in helping the body control bowel movements. These veins form small cushion-like structures inside the lower part of the rectum and around the anus. They help maintain normal circulation in that area and support the tissues that allow bowel movements to happen smoothly. These veins are normally supported by soft connective tissues and surrounding muscles that keep everything in the correct position. When these structures are strong, the veins stay stable and function without causing discomfort. However, as we grow older, several natural changes begin to take place in the body. One important change involves the connective tissues. These tissues act like supportive fibers throughout the body, helping to hold organs, muscles, and blood vessels in place. With age, these supportive tissues gradually lose some of their strength and elasticity. This process happens slowly and is a normal part of aging. Researchers have observed that when these tissues become weaker, the veins in certain areas, especially around the rectum, may become more likely to stretch or expand under pressure. Another change that many older adults experience involves digestion. As the digestive system slows down with age, food often moves through the intestines more slowly. When this happens, the body absorbs more water from the stool, which can make bowel movements harder and more difficult to pass. Harder stools often lead to constipation, and constipation frequently causes people to strain during bowel movements. That straining creates extra pressure in the lower part of the digestive tract. Each time a person strains, the pressure pushes against the veins around the rectum. If this pressure happens repeatedly over time, the veins can begin to stretch and swell. When those veins become enlarged and irritated, the condition is known as hemorrhoids. Doctors often notice several early signs before hemorrhoids become more advanced or uncomfortable. These symptoms usually develop slowly rather than appearing all at once, which is one reason many people overlook them at first. In the beginning, the changes may seem small. A person might notice a little itching or irritation around the anus. Sometimes there may be a tiny amount of bright red blood on the toilet paper after a bowel movement. This can look alarming, but in many cases it comes from small, swollen veins that have become irritated. Some people also describe a feeling of fullness or pressure in the rectal area after using the bathroom, almost as if the bowel movement was not completely finished. Others notice mild discomfort when sitting for long periods, especially on harder surfaces like wooden chairs or car seats. Another early sign can be the presence of small lumps near the anal opening. These lumps are often swollen veins that have moved slightly outward. They may feel tender or sensitive to touch, particularly after straining during a bowel movement. Many patients describe the sensation as a slight burning, itching, or irritation that becomes more noticeable after using the bathroom. Because these symptoms can come and go, it is common for people to assume they will disappear on their own. In my years caring for older adults, I have also seen that these symptoms often become more noticeable during certain situations. For example, they may worsen after long periods of sitting, such as during travel, watching television, or spending extended time at a desk. Episodes of constipation can also make symptoms more intense because straining places additional pressure on the veins in the rectal area. These early signs are the body's way of sending a message. They suggest that the veins around the rectum may be under stress and that certain habits, such as diet, hydration, movement, or bowel routines, may need a little more attention. Recognizing these signals early can help prevent the condition from becoming more uncomfortable over time. The good news is that evaluating hemorrhoids is usually very straightforward. When a patient visits a doctor with these symptoms, the first step is simply talking about the symptoms. Doctors often ask questions like, when did the symptoms start? Is there bleeding during bowel movements? Is there pain, itching, or swelling? A simple physical examination may also be performed. In some cases, doctors may look at the area using a small lighted instrument to see whether hemorrhoids are present. If there is bleeding, doctors may also recommend tests to rule out other causes, especially in older adults. A simple stool test or screening exam can help ensure there are no other underlying concerns. According to medical guidelines, this evaluation helps doctors confirm that the symptoms are truly caused by hemorrhoids. Now let's talk about something reassuring. In many cases, hemorrhoids can be managed quite successfully without surgery. For many older adults, simple changes in daily habits and a few supportive treatments can significantly reduce discomfort and help the area heal over time. Doctors usually recommend different approaches depending on how severe the symptoms are. For mild or moderate cases, treatment often focuses on reducing pressure in the rectal area and making bowel movements easier to pass. One of the most important steps involves lifestyle adjustments, particularly improving the amount of fiber in the diet. Fiber helps add softness and bulk to the stool, which allows it to move through the digestive system more smoothly. When stools are softer, people are less likely to strain during bowel movements, which reduces pressure on the veins in the rectum. Foods that naturally contain fiber include vegetables, whole grains, beans, and many types of fruits. Gradually increasing these foods in daily meals can support healthier digestion and more regular bowel movements. Hydration also plays an important role. Drinking enough water throughout the day helps keep stools from becoming dry and hard. When the body is properly hydrated, bowel movements tend to be easier to pass, which helps reduce irritation in the rectal area. Doctors sometimes recommend topical treatments as well. These may include creams or ointments designed to calm irritated tissues and reduce swelling. Many of these products contain ingredients that help relieve itching, burning, and mild pain. While they do not remove hemorrhoids instantly, they can make the area feel more comfortable during the healing process. Another simple method that many patients find helpful is taking warm baths. Sitting in warm water for about 10 to 15 minutes allows the muscles and tissues around the rectum to relax. The warmth can also improve circulation in the area, which may help reduce swelling and promote healing. Clinical observations and research suggest that many people experience noticeable improvement when they combine these simple strategies. With consistent care and a few adjustments to daily habits, symptoms often become much easier to manage. There are several practical steps older adults can discuss with their doctor that may help prevent hemorrhoids from worsening. These steps focus on supporting healthy digestion and reducing unnecessary pressure on the veins in the rectal area. While they may seem simple, consistent daily habits can play a very important role in keeping symptoms under control. 1. Increase daily fiber intake. Medical research suggests that fiber plays a key role in keeping bowel movements soft and easier to pass. Fiber works by absorbing water in the digestive system and adding bulk to the stool. This helps the stool move through the intestines more smoothly. When stools are softer, people are much less likely to strain during bowel movements. Straining creates pressure on the veins around the rectum, and over time that pressure can contribute to hemorrhoids becoming swollen or irritated. Older adults can often increase fiber by including foods such as vegetables, fruits, beans, and whole grains in their daily meals. Gradually adding these foods allows the digestive system to adjust comfortably. 2. Stay physically active. Regular movement helps stimulate the natural activity of the digestive system. When the body moves, the muscles of the intestines also become more active, helping food and waste move through the digestive tract more efficiently. Even gentle activities can make a difference. Many doctors encourage simple exercises such as walking, light stretching, or other forms of low-impact movement. These activities can support regular bowel movements and reduce the chances of constipation. 3. Avoid prolonged sitting. Sitting for very long periods can place continuous pressure on the veins in the rectal area. Over time, this pressure may worsen swelling and irritation. Taking short breaks throughout the day can help reduce this strain. Standing up, stretching, or walking for a few minutes allows circulation to improve and relieves pressure on the lower digestive area. These small daily habits may appear simple, but over time, they can make a meaningful difference in maintaining comfort and supporting healthier bowel function. Before making changes to your diet, medications, or treatments, it's always important to speak with your healthcare provider. This video is intended for educational purposes only. Every person's medical situation is different, and a doctor who knows your medical history can provide guidance tailored to you. If you've been experiencing symptoms like itching, bleeding, or discomfort during bowel movements, it's perfectly reasonable to discuss these concerns with your doctor. You might ask questions like, could these symptoms be related to hemorrhoids? Are there lifestyle changes that could help improve this? Should we check to make sure there isn't another cause? Doctors appreciate patients who ask questions and stay engaged in their health. These conversations often lead to better care and better outcomes. As we age, our bodies naturally go through many changes. Some of these changes are completely harmless. Others simply require a bit more attention and understanding. Hemorrhoids are one of those conditions that can feel uncomfortable to talk about, but they are extremely common, especially in adults over 60. The encouraging news is that many cases can be managed effectively with simple adjustments and proper medical guidance. Recognizing symptoms early and speaking openly with your healthcare provider can make a big difference. Understanding your body is one of the most powerful tools you have for maintaining health and independence as you age. If you found this explanation helpful, please consider liking this video and subscribing to the channel. Thank you for spending this time with me, and as always, take good care of your health.